So today I am here to do my 17-week pregnancy update. Yay! I am 17 weeks and 2 days today. And sorry, let me just grab my notes because otherwise I will start rambling on and on about everything except what I should be talking about. So since my last update at 16 weeks last week, I did have a emergency room visit, and the reason I went to the ER was because I was feeling some cramping, like a lot of cramping, and I went to my trusty pocket doctor, Dr. Google, and I was just trying to look around and read around and see if, experiencing cramping at 16 weeks was normal. And of course, I came across the round ligament pain, but I also read that round ligament pain typically will happen if you make any quick movements, if you get up too fast, stuff like that. So what I was feeling was more of a constant, period cramp, and it was kind of moderate in pain level, and for about an hour, the whole time I was kind of lounging on the couch, talking on the phone with my friend, and the whole time, though, I noticed that the cramping hadn't gone away. So I thought maybe, I'm going to monitor it for just a little bit longer and try to see what's going on here. And if I'm still feeling this cramping, in another hour or so, then I'll probably just at least call the doctor, find out what I should do before I just get up and go. Well, of course, an hour and a half later, I'm still feeling the cramping. It hasn't eased up. It hasn't really dulled out. It was just the same kind of a constant cramping. So for like 2.5 hours. So I called the women's health clinic where I had my appointment scheduled, and I just let them know my history and what I was experiencing. And she told me to go straight to the emergency room, tell them everything that I told her, and they will take care of it, basically. So I ended up doing that, and gosh, these people in the emergency room are so slow. And there wasn't even a lot of people there, but needless to say, I had to get an IV. They thought that I might have been dehydrated. They said that cramping sometimes can happen if you're dehydrated. And I did explain to the nurse, I drink at least a gallon of water a day, at the very least, at a minimum, just because, not counting, any other liquids that I take in, not counting, any vegetables or, fruits or anything that has water content in it. So, I really don't think that I'm dehydrated, but I ended up getting an IV anyways, which, that's fine. She said if the cramping didn't go away after the IV, then they'll do an ultrasound and so on. Well, the cramping didn't go away after the IV, so she did do an ultrasound. Baby looked good. Everything looked fine. So they just said that there's multiple reasons for cramping, and of course if I have any bleeding or anything like that, to come straight back. So after spending about 9 hours in the emergency room on a Friday, I was sent home. And so that's fine. I'm glad that everything is okay. And that was one less thing that I had to worry about. So next, I had my doctor's appointment, finally. So in my last update, I talked about how when I found out I was pregnant, I was already pretty far along. And then when I scheduled my appointment, they couldn't get me in for like 5 or 6 weeks, which would have put me already out of my first trimester and here, at 16 weeks before I was ever even seen for the first time. So I finally I had 2 doctor's appointments actually in the last week. And so my first doctor's appointment was with one doctor that I was referred to by my primary care physician. I wanted to give this guy a chance just because they did schedule the appointment and it was first. So I went ahead and went to that appointment. Very nice office. I really liked the office itself. Beautiful clean bathrooms, very nice clean rooms, really nice atmosphere. The doctor was cool. He was nice. He was a little bit rushy. He was moving kind of fast for me to be a first-time patient, and I'm trying to explain to you my history and my concerns due to what happened in my last pregnancy. I feel like he was rushing just a bit to kind of hurry up and get out. But aside from that, the visit itself went fairly well. I did ask him about any preventative measures as far as what I can do to, you know, maybe help lessen the chance or possibly even prevent the premature pre-rupture of membranes, or also known as PPROM, from happening again. And of course he tells me, like, basically that there's nothing that I can do to, you know, stop it from happening. If it's going to happen, it's going to happen. If it's not, it's not. And so he continued to proceed the appointment as, you know, just like a regular appointment. So that was fine. I wanted to wait until my next appointment with the other doctor to just get a second opinion about that, because I know that, you know, there are other women out there doing other things that could be helping. So, but anyways, I got an ultrasound done there just to verify how far along I was. And he's like, oh, you're right. You know, you're basically right where you said you were. And I'm thinking, like, duh, it's a honeymoon baby. So I definitely know when I got pregnant. But aside from that, I really like the fact that in their ultrasound room, it's a really nice room. It's a big room. It has its own bathroom in it. It smelled really good. And then they have an extra seating area if you're going to have anybody there with you for an ultrasound appointment. And then they also have a big flat screen TV up on the wall. So everything that's going on the ultrasound machine shows up on the TV. So you're not turning your neck trying to look and you know, see what's happening on the little screen, but you can actually watch, like, you know, the full ultrasound on a big flat screen TV. So I thought that that was pretty nice. So overall, that appointment went pretty well. Obviously, it was just a first appointment routine, so I had to get some lab work done. He did do a PAP, and pretty much that was, also, during the ultrasound, he said that, so during my ultrasound, he mentioned that my placenta looked like it was anterior, and that the reason that posed a concern for him is because I've had 3 prior C-sections. So he has referred me to a high-risk maternal fetal medicine doctor to get a more in-depth ultrasound, just to check on the location and the placement of my placenta, because I guess with the placenta accreta, if it grows into the lining or the scar tissue of where the previous C-section was, that could potentially pose a whole nother issue. So I'm like, here we go with, like, another thing to have me freaking out. But I've decided I'm not going to freak out about it. And I had some confirmation from my next doctor's appointment, so I'm not exactly worried about it. I don't believe that it's going to pose a problem, but I do have that ultrasound appointment coming up soon. Okay, and Mr. Preston is awake from his nap, and he's been sick, so he's a little cranky. So at my next appointment, or my second appointment that I went to, I was able to talk to the doctor again about the options for preventative measures for the premature rupture. And I did specifically ask about the progesterone shots, or the P17 McKenna's, because it's something that I was really wanting to do if it had the possibility of, you know, being a preventative measure. I've heard some good things. I know from my own research that it is not specifically for women who have had pre-rupture of membranes, more so for women who experience preterm labor. However, if it seems like it's working to help keep babies in longer, and it's no risk to mom or baby, or, you know, very minimal or low risk, then it was still something that I wanted to at least know that I attempted to try to give baby the best chance possible. But she also said as well that it wasn't something that was typically for rupture of membranes, but more so preterm labor itself. So she didn't think that it would be necessary, and that most of the time women don't experience this rupture twice. Well, I've seen that go both ways. So I'm just going to stay on the positive side. I've looked into some other ways, and there's also been a study that was done on vitamin C actually being helpful in keeping the amniotic sac strong, the membranes around the sac strong, as well as vitamin E. So I am on a different vitamin regimen, and I did share this with my doctor, and so she didn't seem to have any concerns about the vitamins that I was taking so far, because they're all necessary vitamins for pregnancy anyway. So what I am currently taking is a prenatal vitamin that does include folic acid. I'm also taking a vitamin E. I believe it's 400 IUs, I think it is. And then a 1,000 milligram vitamin C pill. And I take those 3 vitamins in the morning. And then in the evening with dinner, I take another vitamin C, again, 1,000 milligrams. I take a vitamin D, and then I take a zinc. So hopefully that will help just keep everything strong and intact, and it's not really going to be like a concern that we have to worry about. What's up, baby? Hi. Come here. So anyways, moving on. I have gained a total of 5 pounds so far in this pregnancy. I did lose some weight, about, 8 pounds, maybe almost 10 pounds, I think it was, or something like that. I know that I lost weight in the beginning. I was really, really sick, and I didn't have much of an appetite, so I did lose some weight. So when I went to both doctor's appointments, I was weighed, and I came in 2 pounds under my pre-pregnancy weight. So that means that I've gained about 5 pounds, and at least just to get back there. So I don't know if that's considered, I mean, I guess it is considered a gain because I have gained the weight, but I did lose the weight at first being sick. So I haven't reached my pre-pregnancy weight yet. I'm 2 pounds off from that. So the next time I go to the doctor, I'll probably be there, or maybe even past it, because I am feeling better and I have been eating. So I have not been having any cravings, really, like nothing out of the ordinary or major. I mean, I cook what I want to eat for dinners, and it's usually different every night. So but I haven't had any cravings where I'm like, oh my goodness, I have to have this. And I don't think I've been experiencing really any aversions to any foods either. Other than like the milk, obviously, like I was saying before, but I don't really drink milk anyways, so that's what it is. Also, the doctor that I went to the second time, she did explain that about the placenta accreta, and how typically if a woman has an anterior placenta this early in a pregnancy, they usually just monitor it, but more than likely it will move up as the pregnancy progresses and as the uterus gets bigger. So she wants to wait until after that special ultrasound that I have to go do. And she just said that if it does look like it is too close to the old C-section scarring and scar tissue, that it will just be something that will have to have a very close eye kept on it. I'll probably have to be monitored once a week for that. But if it's showing that it's moving up and it's not even anywhere close to it, then it's not something to be concerned about. Other than that, the only thing with the anterior placenta is you may not feel the baby move as early as someone else whose placenta is obviously off to the side or in the back of the baby. So that's okay. I've already felt my flutters, and occasionally I think that I do still feel the baby moving, so I don't think that that is probably going to be my issue. And other than that, you guys, I've still just been doing great. Again, like, aside from the fact that my belly is protruding, I really don't even feel pregnant. Like, I feel good. I'm having a good time. I was just thinking today that I want to take a baby moon with my husband. You saying hi? You say hi. You want to say hi. I hope that we can take a baby moon. We had Mr. Preston here in December, the year before we got married, and then we got married in October of last year. So we did go on a honeymoon this time, which is how this little baby here was conceived. But you know, I just want to spend some time with him alone before this baby gets here and before we have 2 under 2 and our lives really, you know, completely change. So I think that that'll be a fun thing to do. So I'm going to look into some places that we can go kind of relax and maybe spend, you know, a weekend or maybe 4 or 5 days away from all the kids and just enjoy each other before we introduce our last baby into the family. So hopefully that should be fun. And other than that, you guys, I've been doing pretty good. My breakouts have gotten to a minimum, so I'm glad about that. And that's really just it. Otherwise, I'm feeling pretty great. So I will go ahead and show you the belly, and that'll be it for this update. So hopefully you guys can see me. So this is the belly, and this is 17 weeks here. And it's so funny because we just went out this weekend, and I saw my niece, and she, you know, we just kind of announced to everybody that I'm pregnant. I wanted to wait until after I saw the doctors and felt more comfortable sharing with people. But she's like, I mean, how long have you known? And I'll do the other side. And so I'll show you with the shirt up. So remember I was telling you last time about my belly button. It was starting to stick out, like, ew, it's poking. Alright, you guys, so that is it for my 17-week update. Thank you so much for watching. You can subscribe below to stay tuned for my 18-week update next week, and any other videos that I've got going on. And thanks. I'll see you guys later. Bye.